This is ChangeMakers with Katie Goar, finding the right solutions for the affordable housing community.
I'm back with ChangeMaker Dr. Vincent Atchity, the president and CEO of Mental Health Colorado. He's been sharing insights from his career in mental health advocacy, discussing how stable housing is crucial for mental well-being and the challenges faced by those experiencing homelessness. And now, Vincent, I'd like to get into another one of your programs, the Care Not Cuffs initiative.
Yeah, thank you. And it's a catchy phrase to use to refer to efforts that are going on in different levels and places all over the country. And what it is a growing understanding that we as a nation have been over-reliant upon a criminalized pathway for individuals and behaviors that are often associated with unmet health needs, sometimes across the lifespan. And it really represents a shift to what it is that we should expect of a combined public safety and public health effort. And that is, it's pro-human, and it's about as much human recovery and support and value of human life and human resource as we can muster as a community. Because when people are well, the nation does well. Nations do well when people are well. And Care Not Cuffs is really about drawing attention to the emergent leadership across communities that has in its sight an end to that over-criminalization, over-reliance upon the justice system, and a shift to optimizing human outcomes by putting healthcare supports, services, and housing in place. And that's how we create healthy, thriving communities.
So what could community organizations do to help support mental health and really prevent homelessness? Are there tangible ways? We talked about two of these programs so far, but are there other ways organizations could have a more active role in this?
Yeah, good question. I think that the key thing may be the inescapable nature of the challenge of housing the humans, and realizing that it seems like a lot of unproductive conversation about homelessness is kind of the wishful thinking that they would just go away or go elsewhere, instead of recognizing that, oh wait, these are the humans that share the planet with us. There is no elsewhere. And instead, what we who can think beyond the day's needs of survival need to do for each other is build out systems that create adequate access to housing for people in the community. So I think that there ought to be simple math going on in every community where they look at the overall population size and determine that at any given time, and I'll make up a number here, at any given time, 10% of our overall population size may be experiencing housing instability and need to be shored up or housed in some way or another. And then local communities need to be building to that capacity. And it could be a combination of actual housing infrastructure and committing to have a certain number of bed space that provide housing for people. There could be efforts to backfill and suspend rent commitments somehow in the communities, especially for families and aging people, to ensure that people can remain stably housed when some essential piece of their economy drops out or is threatened. But the problem's not going away, and it's not going to be some external party that solves the problem. This is a local problem that humans have with one another. And the sooner we stop wishing people gone and making room for them to be at their best, the better off we're going to be. And in America, it sounds like crazy talk, I think, to talk this way. But I keep pointing at Scandinavian nations, which, while by no means perfect, have definitely set a bar for Americans to compete with in terms of creating that kind of stability across the lifespan.
And does it matter necessarily why people are there, meaning why they're homeless or why they have housing insecurity? And is it our role to understand that, or should we just be focusing on meeting the current need? I mean, it's a philosophical discussion that happens when we're trying to identify solutions. What do you think on that?
Well, and I think I land on the side of that philosophical discussion that is talks about housing first. And it's kind of like, to put it in an emergency room analogy. Sure, somebody may have a complex set of conditions that it's going to take some diagnostics over some testing time. But if they're bleeding, you stop the freaking bleeding. And then you worry about everything else that's going on. And I think that housing first is that. It's definitely that for children. It's definitely that for elderly folks. It's the same for everybody. And if we get in there, stop the bleeding by providing that housing first so that all of that distress somebody is experiencing today from some complex of co-occurring conditions is at least met with, here's your cup of tea, here's your warm blanket, here's where you get to lay your head tonight and where you're going to be safe and respected and not have to worry about that. Well, then your team of people who care about the outcomes can get in there over more time to evaluate the variety of needs that may have put you in this unstable position. And it's just intelligence operations to recover and optimize human capacity for experiencing well-being in the community.
You have a lot of social service providers who are in that space of building housing, meeting housing, managing housing. They're a strong advocate in this community you're talking about. But how do you have conversations with private developers to either set aside units for special populations that we've been discussing, or to build properties and communities that are specific to their needs?
Great question. And, I'm not sure it's just a matter of conversation. There are community settings in which developers are at the table and will build things like a certain number of affordable housing units into whatever broader commercial structure their project they're engaged in. Honestly, I'm not sure they do it just on the basis of conversation, or whether it's because the community has built in some kind of a requirement, expectation, or incentive for developers. And Colorado has something called the low-income housing tax credit, which is one of the drivers behind the creation of permanent supportive housing that Colorado has invested in. And it's what makes it appealing to developers, is that there is this tax credit that can offset some of the gains from other areas of investment. There's a lot of low-income housing tax credit available out there that every community ought to be availing itself of.
This leads me to the next obvious piece here. There's been a recent Supreme Court decision in Grants Pass versus Johnson, implications all over the nation on how communities are responding. Do you care to comment on this? Do you have an official stance as the CEO of Mental Health Colorado?
Yeah, and I mean, difficult to not just make observations about the mental health implications of this Supreme Court's series of decisions that affect human health and well-being for vulnerable communities. There's a lot to be challenged there, and it will be challenged for decades to come if we've got the voice to keep doing that challenging. This particular one, it's a decision with a cascade of consequences that are inadequately examined. And the obvious one is, okay, so you can clear an encampment, and then what? And that's the big question there, is the and then what? And, I think that it ought to be every community's objective to alleviate themselves of homeless encampments that are not good for anybody to live in those kinds of conditions. But that's the challenge, is what is it? And, we can easily go in and sweep up a bunch of tents under a free highway overpass. But what is the disposition of those individuals? And I think that gets us back to this other conversation, which is, well, that's fine, community, but you need to embrace these individuals as individuals that are part of the community and create a housing first pathway that provides an array of supports and services that is geared toward meeting health needs and recovering as much functionality and potential for integrating as can possibly be done, because that's what's good for everybody. That when we're building a pro-human community and taking sad stories and yielding positive outcomes, I mean, that's what lights hearts on fire in communities, and that's where we ought to be living, making those conversions of folks' sad stories into stories of success and improved well-being.
There have been recent conversations about changing some of the structural barriers for people to get into housing, looking at the time and duration of prior felonies, misdemeanors related to substance abuse, for example. And there's starting to be somewhat of a crack in the prior schools of thought, saying that they were absolutely not allowed to come back into some affordable housing components. Have you seen any conversation there within the state at looking at some of that, or any trends that you're watching?
Yeah, and I mean, that is that housing first approach to things is really just acknowledging that the best and first thing to do is not hesitate and lower barriers to accessing housing, and then to apply different levels of intervention that may mitigate someone's harmful substance use or reduce their uh, likelihood of deeper involvement with the criminalized system. That's the kind of work that we're doing in the SAFER initiative in Arapahoe County. That's the kind of work that WellPower has done in Denver with some of its permanent supportive housing programs. The Second Chance Center, also in the Denver metro area, does this kind of work. And it's just taking on the complications of people's needs and meeting them with more coordination of effort.
We've talked a lot about the individual just kind of being this static, vague type of an entity, but personalize this for us, because I know there's families with children. I know there's aging population. I know there's youth coming out of the foster system, but start to personalize this for us. Who are we talking about?
Yeah, it's a great question. So I think that we have what I've been thinking of is like our natural ecosystems of care that many of us were, fortunate to be born into families. And there is some natural ecosystem of parents and children and cousins and aunts and uncles who would be inclined to care for and support somebody. When certain mental health conditions or substance use conditions are unmanaged and the needs are unmet, those individuals can wear out their natural ecosystem of care because it's a gigantic burden, and it's especially a loaded burden sometimes for a family member. And so those individuals end up impinging on public systems because they've worn out that natural ecosystem of care. And, as children go from being difficult to manage 8-year-olds to being large 16-year-olds who are difficult to manage, that's a strain on a family or on a single mom that becomes unbearable. And those individuals become at greater risk of institutionalization, whether in a criminal justice setting or kind of a healthcare setting or a foster setting. And similarly, at the other end of life, everybody talks longingly about the notion of aging in place and all that. But the fact of the matter is that as people advance in age and become unable to meet their own basic needs and often experience amounts of confusion about their location and possible risks of harm to self, they need formalized support that is beyond the scope of their families in many cases. And so we need systems of care that don't let people like this fall through the cracks. And these are people who, in a better state of support, if they're housed, if their health is being optimized through access to care and treatment plans and medication that is often helpful, people can do well, comparatively well, in terms of remaining housed and remaining employed or remaining part of their community. But if access to those technical assistances, such as care providers and medication and housing, are unavailable, then people are going to experience the worst possible outcomes. And it seems like a pretty simple population math.
And when you have people moving from couch to couch, bridge to bridge, apartment to apartment, but there's also not a consistency in their mental health plan and in their health care. And so you start to see things really falling through the cracks, which inevitably is also not going to be a long-term comprehensive approach for themselves and really not beneficial for helping them get that next launching step forward. So this is a very, very complex dynamic that I think that we've yet to really unpack all the needs here for the individual and for the person involved.
Yeah, it's complex. And yet I think it also comes back to the sort of simple message of caring and knowing that it's not enough to care as for a community to only care for those that are perfectly capable of caring for themselves. A human community is measured in its humanity by the systematic dedication it brings to caring for the vulnerable. And we generally fail in American communities on that front and need to get better at that. And I think, again, it comes down to that understand that the people are not going away. The people are not to blame. What it is the phenomenon. It's a hard planet. It's a hot planet, right? And it's a hard planet. And we need to understand that in every given human community, we should be building out the muscle and capacity to be continuously intervening, dusting off, and reinserting humans to the best of our possible ability. But we're not going to be done with that. It's just something that we need to get ourselves accustomed to be doing. And that's having adequate access to housing, healthcare, supports and services for a significant percentage of the population. We talk about a fifth of the population at any given time experiencing mental health needs, and we don't build to that capacity. And, the other analogy I'll use is that as communities grow, we apply all kinds of intelligence to the Department of Transportation because we expand highways and roads, and then in other areas we build out plumbing and sewage and electricity. We build all kinds of infrastructure for growing populations, but we act surprised when a growing population yields growing demand for housing, healthcare, supports, and services. And we should just stop as communities acting so surprised. Instead, understand that we need to put these things in place, anticipating our growth of population.
While a national housing policy has sort of evaded things for quite some time, and I think with the pandemic, you started to realize how many people are right there on the verge of housing insecurity. So it changed the conversation for the first time. I don't know if that's what you also saw, but you now see a lot more people willing to engage in what a national housing policy or looking at some of these supply and demand charts that have been around for a while, what they're saying. Is that what you also started to see as well?
Yeah. And, this day and age with all of our mental health crises going on, I really want to put all of my money on what Americans thinking intelligently about pro-human outcomes in their communities are capable of accomplishing. And, you know, that's the best thing the world has got going is what Americans can get themselves together to do better. And so everybody ought to be putting their money on that kind of intelligent, pro-human cooperation on the part of leaders who really care about the health of the public and our future well-being as a nation. And hopefully we'll get a chance to reaffirm our commitment to that kind of pro-human America that the whole world wants to see.
As we close out here, I want to end on a note. If you could share a success story from your work that demonstrates the impact of how proper mental health support and housing stability have been able to work together in the way it should.
Yeah, well, to begin with a broader generalization, what efforts like our SAFER program are discovering and underscoring with their accumulating evidence basis statewide is that when you put housing and supports and services for people, their reliance upon and the cost to taxpayers represented by crisis intervention, emergency departments, first response, court systems, jails, prosecutions, all of those things are mitigated when this array is put in place. And in our own context, in the SAFER initiative, there's a great success rate of individuals who are helped to find their way through that housing first capacity and have been able to be located in apartments of their own in the community, employed by major businesses in the community, and experience no return to justice involvement or further incursion upon those more costly safety net systems. Individuals succeed with a high rate of success with this kind of support.
Excellent. I've been speaking to Dr. Vincent Atchity, the President and CEO of Mental Health Colorado. Vincent, thank you so much for your time.
Thanks so much for having me.
Thanks for listening to ChangeMakers with Katie Goar. To find out more about Katie, go to quadel.com. That's QUADEL.com. This has been a production of Forbes Books Radio.